Hi everyone, I'm Elijah Shabazz. I'm a veterinary technician. I've been in the field for almost 20 years, working as a critical care nurse and triage nurse for pets. I'm here today to talk about pet awareness in order to increase the quality of life for our pets. In emergency services, over 50% of the emergencies in our pets are gastrointestinal related. An upset stomach in pets can be caused by a vast number of things, from our pets putting things in their mouths they're not supposed to our pets being fed an unhealthy diet. We as pet owners sometimes unknowingly feed our pets toxic foods, such as chocolates and grapes. Cats love snacking on household plants, which incidentally, we expose our pets to some toxic plants, such as the lily plants. Lilies are highly toxic to cats. Even the exposure to the pollen can be toxic to cats. The small animal gastrointestinal system consists of the mouth, esophagus, stomach, small intestines, and large intestines. Each part anatomically helps in aiding a healthy life for our pet. The purpose of the gastrointestinal system is to absorb foodstuff, reabsorb water to form perfectly formed stool, and excrete liver and kidney toxins. Gastrointestinal emergencies can vary from minor to major. Some minor emergencies include intestinal parasites, dietary indiscretion, or even when our dog is enjoying that hand hock bone and it gets stuck wedged on its lower jaw. Major gastrointestinal emergencies involves esophageal or gastrointestinal foreign bodies. Foreign bodies are foreign objects ingested by our pets. Foreign objects can consist of small balls, small toys, rocks, sticks, bones, underclothing, or any other small object our pet managed to swallow. Usually, induction of emesis is a choice used by veterinarians to treat foreign objects swallowed by our pet. It depends on if the object is blunt and what time our pet ingested the object. The doctor will choose induction of emesis, which is an intravenous medication given to bring up the foreign object from our pet's stomach. Bones are an exception. The veterinarian would like to take an abdominal x-ray to see how the bones was chewed before swallowed. If the bones was chewed into sharp or jagged edged pieces, the veterinarian will be reluctant to cause vomiting because these bones can get stuck in the esophagus or puncture the stomach on the way up. Other gastrointestinal emergencies can include toxicities. Toxicities like owners' medications, which are common. Rodenticides, which is rat and mice baits. And baits are of concern because it's not enough poison in the contraption to cause any damage to our pets. The concern would be if it's a small breed dog that ingested the whole contraction, which can lead to an abdominal obstruction. Other major gastrointestinal emergencies can include abdominal cavity malfunction or failure, and diseases such as pancreatitis, liver, kidney, gallbladder abnormalities, metabolic abnormalities such as an Andersonian crisis, parvo puppies recently bought from puppy mills, GDV, which is gastroesophageal Dilation volvulus, generally seen in large breed dogs, which requires immediate surgery. Symptoms for gastrointestinal illnesses can include minor and major clinical signs. Minor would be bouts of vomiting and diarrhea and decreased appetite. Major concerns would be frequent vomiting, diarrhea, and sometimes accompanied, which is called with HGE. HGE stands for hemorrhagic gastroenteritis, which is a watery, bloody diarrhea, commonly mistaken by pet owners as imminent danger. HGE can resemble blood, and a pet can present as dull. Dull is a veterinary terminology used to describe severe lethargy. I must add, in small breed dogs with frequent bouts of vomiting and diarrhea, or HGE and vomiting, can be life-threatening because of the frequent bouts of diarrhea causing rapid decrease in blood proteins, electrolytes, and bodily fluids, which can lead to a poor volume of fluid circulating through the vascular system, therefore leading to hypotension. Diagnostics for gastrointestinal emergencies include blood work and x-rays. Blood work is complete blood count and chemistry. X-rays is 2-view x-rays of the abdominal cavity. Further diagnostics can be recommended. Diagnostics can be sent down to the lab. An abdominal ultrasound can be performed. Abdominal exploratory can be recommended. And CAT scans can be performed to help identify cancer within the abdominal cavity of our pets. The general cost for baseline diagnostics range from $600 to $800, which includes the emergency examination fee. Further diagnostics will only be recommended after the veterinarian interprets the baseline diagnostics. Treatments for gastrointestinal illnesses can be inpatient or outpatient. Outpatient treatments consist of medications used to resolve gastrointestinal symptoms, the vomiting and diarrhea. Subcutaneous fluids used to aid in rehydrating our pets. Subcutaneous fluids is given under pets' skin. Pets have a large volume of space between their skin and tissue where a large volume of fluids can be administered. At discharge, clients are recommended to follow up with oral medications, which is generally given with meals, and feed pets bland diets. Just like when we are going through sour gut, we eat bland foods for several days, then gradually introduce rich foods back into our diet. In the case of our pets, the normal food is considered rich foods. Inpatient treatment is more aggressive, which includes intravenous fluids, intravenous medications, a bland diet fed. Further diagnostics can be recommended based off recheck diagnostics. And again, your further diagnostics is the abdominal ultrasound, abdominal exploratory surgery, or a CAT scan. With awareness, we as pet owners can drastically decrease the amount of gastrointestinal emergencies seen through emergency services. By being aware of what we're feeding our pets, vigorously monitoring what our pets are placing in their mouths, closely monitoring the dangers in the environment our pets are in, and carefully storing our medications out of reach of our pets can help decrease the percentage in gastrointestinal emergencies. And let's keep in mind, when we enjoying our favorite pastimes like family barbecues, the foods on the family barbecue menu can cause inconvenience for our pets, such as pancreatitis or HGE or a combination of both. And be careful and secure the trash to keep our pets from ingesting the dreadful corn cob or bones, which can lead to esophageal or gastrointestinal foreign bodies. Also, during our summertime walks with our pooch, let's preparate and have cold or frozen water available for our pets to rehydrate with, to avoid heat stroking our pets. And as I like to say, give your pet a nice cold treat to beat the heat. Have a good day.